You're watching this video because a surgeon recommended an arthroscopic meniscus tear repair, also known as keyhole knee cartilage surgery. The purpose is to reduce pain and restore function to the knee joint. This method of repair involves taking a blood sample to form a blood clot that is used to aid the healing process of the meniscus. This keyhole operation involves making small cuts around the joint to insert a camera and instruments. The joint is filled with a saltwater fluid to expand it and create room for the surgeon to operate. The joint is visualized using a keyhole camera, and the TOM cartilage is secured back into place with stitches. Before tightening the stitches, the blood clots are inserted between the layers of the cartilage to encourage them to repair using cells from your own blood. The stitches are then tightened. The fluid is drained at the end of the procedure. The cuts are then closed with stitches. The contents of this video are a general depiction of this procedure and the risks involved. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team. Thank you for listening. Please watch this again to ensure you have understood everything.